Sona Jai Shri Krishna, Jai Jirendra, Jai Swaminarayan Sairam, and good evening to you all. Good evening, everyone, and thank you so much for joining us today for Talk 5 in our Health Awareness series focused on very important topic today is bowel cancer. As you all know, my name is Panna, and I'm delighted to welcome you to this session presented in collaboration with Brent Health Matters and St. Mark's Hospital. Before I hand over and introduce to them, can we just give a minute of condolences, well, a minute of respect for today's incident that had happened in India, and we've lost so many British people as well. So please, let's give a minute of silence to everyone, and we pray that everything happens safely. Some of them we've lost quite a lot of dearly people who have left children behind as well. So let's give it a minute of silence, please. Om Shanti Shanti Shanti. Once again, I welcome everyone. And today we are joined by two expert speakers. That's Nazia Ali from Brenta Health Matters, and Andrew Prentice from St. Mark's Hospital. And I am just going to hand over to both our colleagues, making them co host, because I'm sure they would like to use or share their screens. Nazia, all yours.
Hi, Panna. Hi, everyone. Thank you, GAA, for giving us opportunity to, do this session on bowel cancer and the bowel cancer screening program by St. Mark's, in collaboration with St. Mark's Hospital. So, without wasting time, I would like to share my screen. So we have Andrew. Andrew, if you can say hi to everyone.
Hi, everybody. Thank you very much for asking me along. My name's Andrew, and I work at the Bowel Cancer Screening Centre at St. Mark's.
Yeah. Thank you, Andrew. So I share my screen now. Yeah. Do you see my screen, all of you?
Yes, we do.
Yes.
Yes. So do you see it with all the tabs, or shall I start the slideshow?
Start the slideshow, Nazia.
Perfect. If that's okay? Yeah, visible?
Yeah, great.
Okay, perfect. So as you know, today we are here to present you an awareness session regarding a very alarming, you can say, a cancer which we would like to, let you all know about, bowel cancer, and of course the screening program that the NHS provides all of us. And definitely, we would be doing a lot in detail about the eligibility, and a lot we'll cover today. So if we move to the next slide. So what we will be mainly covering today is what is bowel cancer, some facts around bowel cancer, some of the symptoms that we need to be careful about the bowel cancer. And of course, we also need to know the risks associated with bowel cancer and what actually is contributing a lot to these increase in cases in UK. And we will also talk a bit about some of the preventative measures that we can take to prevent the bowel cancer, or the formation of polyps, which is at early stage actually. And we will also discuss some of the barriers and the reason why the uptake is so low within certain communities and overall in UK of this screening program. And of course, I will demonstrate to you the new bowel cancer kit, and we'll discuss a bit about the eligibility criteria as well. Okay, so as you know, bowel cancer is the second largest, UK's second largest, biggest killer after lung cancer. And unfortunately, the uptake of bowel cancer screening is quite low in Harrow and Brent, and significantly very low in the minority ethnic group, which definitely puts a majority of us, especially in Brent and Harrow, in here. Because I think St. Mark's Hospital, Andrew, if I'm not wrong, it deals with a lot in the Northwest London, isn't it? The hub is for the Northwest.
Yes, that's correct. So we cover Brent, Harrow, Hillingdon, and North Ealing, but actually, St. Mark's is a specialist gastro hospital. It's the only one in the country. And so we get referrals from all over the country, in fact, all over the world. People are sent to St. Mark's.
Yeah. So like any other cancer, if bowel cancer is detected early, of course, the survival rate increases significantly. So just sharing a bit of statistics around the bowel cancer is like every year, around 44,000 cases are detected in UK of bowel cancer. And unfortunately, it also leads to around 16 to 18,000 deaths. But the good news is that 53% of those bowel cancer cases can survive for 10 years or more if detected early. And around 54% of those cases could be prevented. So here, what you see now is overall how how our bowel looks. So if you see on the left-hand side, this picture, this is how the large intestine, or we call it a big bowel or the colon, is represented by this brown color, while the small intestine or the small colon is represented by this pink structure. Though cancer can occur in small intestine, but basically this screening program detects these polyps and adenomas and the cancer in the large colon, basically. And if you see on the right-hand side, it shows a cross-section of our colon, and it shows how actually cancer develops in our intestine and or colon. So what you see in here, if you see these small outgrowths, so how it all starts is like due to our lifestyle or whatever risk factors, which we will discuss later. It all starts with a small outgrowths inside the inner lining of our colon. And these small outgrowths are called polyps. A lot of you might have heard about this term. And these polyps, over years, if it remains undetected, then what happens? It grows bigger and bigger. And finally, it turns into a bigger structure called adenomas. And this adenomas, mind you, is not cancerous, but then further, this adenomas actually turn cancerous in later stages if still it, remains undetected for years. So basically, this screening is all about detecting these polyps and adenomas at a very early stage and removing it before it turns cancerous. And as you see here, so early detection can lead to early intervention, easier treatment, and of course, higher survival rates. So these are some of the symptoms we should be aware of and be careful about, because this looks quite like, very common symptoms which we we experience maybe in day-to-day, our life. But when it persists or lingers for more than 3 weeks, that's when it's very, very important that we visit the GP and talk about and report these symptoms. So what are these symptoms? Is first, when we actually notice some change in our bowel habits, for example, constipation, or we start going to toilets more often than our usual time, and or we start experiencing some tummy pain, some looser stools, that's when you have to be you need to be careful. And also blood in the stool. If you start noticing some blood in your stool, don't panic, because it could be due to piles and hemorrhoids, but it's quite important that you notice these things if at all it is visible. And of course, abdominal pain, discomfort, or bloating, usually after eating, which might be a normal symptom for some days, but then, as I said, for more than 2 or 3 weeks, you need to visit your GP. And of course, a lot of people also experience tiredness and a weight loss for no obvious reasons. So these are some of the bowel cancer symptoms that we should be aware of. And as I said, if it persists for more than 3 weeks, we need to visit their GP and report it. Okay. Coming to the NHS bowel screening program, as I said, one of the biggest barrier to this screening program is people think that if you don't have symptoms, you don't have to do this screening test, basically, because like most of our health condition, we go for some tests and screenings only when we have some symptoms. So, when we experience some symptoms, but I would like to emphasize the fact that it is a asymptomatic screening program. You don't have to wait for symptoms to become apparent, because it could be too late by then. And when you receive this kit, basically, I will tell you how and when you receive this kit in later stage. But when you receive this kit, home testing kit, it's very important that you do this screening and this stool test, basically, and send it to the hub for the investigation. So as I said, bowel cancer, it starts as a small polyp. It grows into adenomas, and then it turns cancerous in later stages. So this screening is all about finding these polyps and adenomas in an early stage. Okay, So this slide you see are the different stages of bowel cancer. So if at all we find cancer due to this screening, these screening tests, it's usually in stage 1 and 2, and that's when it still is highly curable and intervention is easy. But if we wait for the symptoms to become apparent, or we neglect our symptoms, and if the cancer is found in a little later stages, like stage 3 or 4, you see from the picture that that's when it starts spreading to other parts of the body, and that's when it might become fatal. So that's the importance. So even if it's detected, this screening takes through this screening test, it's usually in the stage 1 and 2. So as I mentioned, if the cancer is detected at the stage 1 of it, around 9 of the 10 people would survive. But if it is found around, it's detected at the stage 4, only 1 out of 10 would survive, unfortunately. So why, I mean, I would like to discuss some of the bowel cancer risk, why the bowel cancer cases are rising. So as I mentioned in the very earliest slide, 54% of those bowel cancer cases are preventable. So as you see, 28% of those cases are actually caused by too little fiber in our food these days. And then another 13% of those cases are caused by eating a lot of processed meat, sausages, salami. And we know our lifestyle these days, especially in the younger generation, so we are consuming a lot of processed meat, actually, and that's when this is actually leading to a lot of bowel cancer cases. And of course, by obesity and being overweight is also one of the causes. But I also want to highlight some few other also risk factors that is contributing to increase in the bowel cancer cases. One is smoking, because it's been seen that the people who smoke a lot tend to develop a lot of polyps in their colon, and that's why smoking is one of also very important contributing factor increase, which is leading to increase in the polyps and cancer cases. Of course, as I mentioned, processed meat, alcohol intake, over consumption of alcohol, low intake of plant-based ingredients, especially as I mentioned, the fiber, high body fat and obesity, to some extent genetic factors, but yes, that is also one of the could be reason. And of course, if somebody has a previous history of this inflammatory bowel disease or colon disease, then there is high chance that it might relapse sometime. But then people also with type 2 diabetes, compared to male and female, male tend to develop more polyps, and their cases are more compared to female. But interestingly, it's the male who take this screening very less, they're very unlikely to take the screening test. And of course, with old age, as we grow old, the chances of this cancer, bowel cancer, increases. So just an overview of, there are a lot, of course, but just giving you a just overview of what the fiber intake could be for in our daily food. So you could see a lot of food which we might be consuming in our day-to-day life. And of course, you have to visit if you are on certain restriction, please do obviously consult your GP. But then these are just few of the things I just want to highlight, like something like corn, lentils, chickpeas. We know these are very high in fiber content. So yes. Okay. So how do you reduce the risk of bowel cancer and of course the development of all those polyps? Like any other health condition, making that lifestyle change is a key. So exercising regularly, reducing the consumption of alcohol, and reducing, stopping your, smoking, and of course trying to achieve and maintain a very healthy weight for yourself, and eating a very healthy, balanced diet. These are some of the, measures we could say, I mean, like preventative measures, or some of the measures which we can take to reduce the risk of bowel cancer or development of those polyps. So, as I said, what could we do to prevent these cases and, and the chances of having bowel cancer. So of course, as I mentioned, the reducing those risk factors which we discussed, and eligibility wise, anybody in UK who is registered with the GP from age between 50 to 74 is automatically invited every 2 years from the NHS bowel cancer screening, hub for a fit home test kit. Yeah. So anybody, so it's very, very important that you have your GP address, correct and updated if you change your address, so that you receive this kit every 2 years, free NHS kit, of course. And at 75 and above, it doesn't mean that screening stops after 75 years and above, but it's just that it leads to a different pathway. I'll share the number of the St. Mark's Hub where you have, it is all about self-referral. You have to call that number to order the kit. And sometimes when we are also doing sessions on, face-to-face, we also take orders from the residents just to save their time and effort, and take order and send it to the hubs for checking their eligibility, and of course the kit are sent to their home after checking all the relevant eligibility. So make sure that if you have for the past 2 years, if you have not received your kit, and if you're in between the age between 50 to 74, please make sure that you call that number, which I'll share at the end, and see and ask the hub to send you the kit, basically. And as I said, prevention is always better, and this screening program can remove adenomas before they become cancerous, and as early diagnosis can lead to effective treatment if at all cancer is found, because it's usually in the early stage. So this is very important.
Sorry, Nasir,
Yes,
could I
Andrew?
just add
Yes.
something there?
Yes,
I think,
please add in.
I think you're really correct when you say that, people don't do the test because they think, oh, I haven't got symptoms, don't need to worry. So we do want people to do it. And I think the interesting thing that's really important that people understand is that actually of those that do come, almost 60% of people have adenomas removed. So that's a huge number that are actually where we're quite possibly preventing cancer. So, even if you haven't got symptoms, it is still really important to take part because, as I say, we can stop cancer before it starts. Thanks, Nazir.
Thank you. Thank you, Andrew. Okay. The most important part of our session is, because most of you have seen or might not have seen, is I want to demonstrate the test kit, the FIT test kit, which you will be receiving from the hub. So what this kit looks like, it's a box. When you open the box, you would find, an envelope, a letter, an instruction kit, and also a small file or a bottle, you would say. It's a small amount of liquid at the bottom, and we have to make sure while we take the sample, we have to make sure we don't drop this liquid or lose this liquid. So yeah, the most important thing, because another barrier what people say and what we face is like people are very much concerned about the practicality and the hygiene part of taking the sample. So what I want to show you is like how easy it is to take the sample without in fact touching it, and in fact you can wear a gloves as well if you wish to, and it's very quick basically. So what you have to do is take a very small takeaway container, put a clean takeaway container, put a tissue paper on it, and when you're ready to take the sample, just go to the toilet, pop this container, into the pan of the toilet when you want to take a sample. Take a small amount of sample, your stool sample, put it on the side, yeah, and open this. If you say open this bottle, and if you open the bottle, you would see. I'm not sure if it's visible through. Yeah. So you see a groove. Yeah. There's a groove at the tip of this, you know, bottle, applicator, you can say. So what you have to do is that you run this stick across your stool sample, just enough to fill the groove. So you don't have to actually take too much or too little, just enough to fill the groove, and just pop it back into the the bottle and click it shut. That's it. Hardly 5 minutes of your time or 10 minutes of your time, and you are done. You don't have to touch your poo. You don't have to, even if you want to wear the gloves for your own concern, so you can. But and then you can of course throw this away. But the most important thing is you have to write a date, when you're taking the sample, otherwise your sample won't get analyzed. So nothing, no name, nothing, you just have to put the date, and the envelope, what you get it, you just have to pop it inside the envelope, peel it, seal it, yeah, and just drop it to any nearby post box. Neither you have to go to your GP or to post office, just drop it to your near post box. And this will be, of course, sent to the hub. And within 2 weeks, Andrew, if I'm not
Yep.
wrong, yeah,
Yep.
within 2 weeks, you would get the result. And don't panic with the result. It's positive or negative. Of course, it's negative, great. Even if it's positive, it could be just they have found the blood in your stool. You don't have to panic with the result that, okay, there could be something dangerous, but no. So just wait for 2 weeks to get the result. And Andrew, if they don't receive it, is that the same number they can call up?
Exactly.
Okay, so I'll share the number of the hub at the end. So if you don't receive your result within 2 weeks of sending the sample, you please call that number to find, what's happening with your result. Yeah. So I hope there's a clarity on how to take sample and all. Otherwise, I can repeat it. I can take a question. I can take question at the end. But if you have any question right now, please, you may ask. Anyone? Is that okay? Yeah. Fair enough. So this is very important because, before 2019, because while I've been doing a sessions with a lot of elderly population as well, before 2019, the kit used to look very different. It used to have a flap-like thing where you used to take samples and all. And I understand maybe that also used to put a lot of people off, and that was not that sensitive enough. But now this fit kit is quite sensitive, very quick, and as I showed it to you, quite hygienically, quite better, and you don't actually touch your stool, and you can send the sample to the for analysis. Yeah.
And
So
just to add there, Nazia, that
yes, please,
the
Andrew.
new test, the old test, sorry, we used to get false positives. There were certain food substances, and that would trigger it, whereas the new kit will only react to human blood. It will only react to human blood, so it's much more sensitive, and much more effective, and much easier to do.
Yeah, definitely.
Thank you.
So I've covered most of the things. So as you see the slide right now, why people are hesitant and why there is a low uptake within our community or in the wider community to take up this screening test. Of course, the one of the thing is, of course, the fear and denial around the test outcome. We always think, okay, as long as I don't know, it's fine for our peace of mind, but that shouldn't be the case, because if we are living with those polyps and adenomas, and if something is detected at a very later stage, we know it could be quite fatal. So the fear of outcome do prevent us, but then it's always good, to take this test, because you just have to do every 2 years, and it's quite good for your peace of mind, just take the test, and if it's negative, it's all good. And another, as I mentioned, the next one is, like, many people think, oh, I don't have symptoms, so I don't have to take the test. But that's not the case. As I already told you, it's an asymptomatic screening program. You don't have to wait for your symptoms to come, because if symptoms come and you visit your GP, that is a different pathway altogether. So, and then compared to the male and female, as I mentioned earlier as well, that males are less likely to take part in the screening compared to female. But statistics have also shown that men develop more polyps compared, to female, and of course, the whole thought about hygiene and practicality also had prevented people from taking up this screening test. But as I showed to you, it is quick, it is more hygienic, and you can get it done in few minutes. And it's very much, and of course, lack of awareness among a lot of group. language barrier could be one of the reason, and that's why we are also trying hard to reach out to communities with translators and also interpreters, so that every community do receive this message. And that's it. These are some of the reasons why the uptake is low, and probably through these sessions, through these awareness program, and you all passing on this message to your family and friends could help us, increase this uptake and prevent more, rise in the bowel cancer. Okay. I can take a question. Salma, somebody has raised a hand, please. Yeah.
Yeah. Thank you. Thank you, Nazia. I'm 73 years of age, and I've had hemorrhoids for a long, long time. So I bleed quite regularly, small amounts. And my last fit test was January 24. But the bleeding has changed, that in that it has gone rectally, it has gone much more. So, my thing is that the fit test says that it will detect blood. So do I need another test, or would I just actually not wait to be called again from the
No.
screening?
Andrew,
If
you would
you've
like to
noticed,
comment?
yeah, sure. If you've noticed any changes, we recommend that you speak to your GP.
Okay.
Don't wait till your next screening round,
Yes.
but speak to your GP.
Okay. Thank you.
No, you're
Thank
welcome.
you. Okay, so this slide is just to put you all at ease that, this kit is not that scary. This test is not that scary. So for every 100 people who complete this test, around 98 people don't need further tests. It's mostly negative. And even if two out of those 100, even if two need further tests, it could be just that they found some blood in the stool. And of course, they will call you for further, they'll give you an appointment for further investigations. So even if you get positive, you need not panic. Just follow, their instruction and come for further appointment and further investigation. And from those two, from those two statistics out of 100, if we make another, you say a group of 100 people, so 13, we would say that 13 will have a normal test, and then 25 will have minor findings, which might not need any further treatment. But 53 out of that whole sample of people could have had adenomas removed. So adenomas, as Andrew mentioned also earlier, that removing those adenomas doesn't mean we have found cancer, but we could have prevented cancer for those 53 people. So it's so much important that we give so much importance to this screening, because even if you remove those 53 adenomas and polyps, it's so important that to know that we could have prevented cancer for those people. And if you see the 9 people out of that sample, even if they get detected with cancer, it could be at a very early stage and more likely that they are highly curable. Yeah. So, and to make this whole sample, as you do, if you do the mathematics, it would require around 5,000 people to actually complete this home test kit to find these many people with adenomas or cancer. So it's though cancer is increasing, but it's also important that to know that this screening program help you remove these adenomas in a very early stage. And as mentioned, if most of you know where St. Mark's Hospital is, it's just behind, behind the Northwick Park Hospital. So it's a specialist hospital dealing with gastrointestinal diseases, and it's one in, I think, Andrew, I think you can explain a lot more
Well, so as I
about St.
mentioned
Mark's
earlier,
Hospital. Yeah.
it's the only centre of excellence in England and in the UK for bowel disease, and it's only one of 17 in the world. So I think it's about realizing you've got a really expert team on the doorstep that will be looking after you. And as I said, mentioned people fly in from all over the world privately to go to St. Mark's, and you'll be seeing that same consultant, the guy who's just flown in on his private jet. You'll be seeing the same person. So you're really well looked after.
Yeah. Thank you, Andrew. And these are, as I mentioned in the early stage, so this you can take a picture if from your laptop or wherever you are. Just this is the number of the St. Mark's Hospital Hub, the helpline and the self-referral number, so that you can call up to order your kit if you haven't received it for the last 2 years, or if you have any concern, Andrew's email ID is here with the the number it's also on the screen, which you can call if you have further question or any query regarding the whole program or the test. And of course, if you see down, this is a Brent Health Matters advice line as well. So this is not just for bowel cancer, but of course for your overall health and well-being. If you have anything you want to talk about, you can always call the other number at the end. But the main thing for bowel cancer is please call the first two numbers. And as you see, there is a website of stmarksbowlscreen.co.uk where you will find a lot of resources in different languages. I think you have a lot like Gujarati, Romanian, a lot, many. If you just see, whatever we talked about, how to take sample and how the symptoms, everything we talked about, you could also find in your own regional languages. And please, a lot of resources which I think you can access through this website. Thank you so much. I think it was short and sweet, and I hope we conveyed the message in the right spirit. And if you have any question, we are open to it, please. Thank you.
Thank you very much, Nazia. That was a wonderful session and nice and quick and small. But I would like to ask you a question on behalf of others, obviously. How does the fit kit work, and how accurate is it for everybody else to, to relax their mind thinking, okay, how confident they are going to be after hearing it?
Sure. I mean, as I say, the new test is incredibly sensitive, and it's fairly accurate, very accurate. I mean, no test is 100%. Because I mean, also what happens is with these polyps, because we're looking for blood, so the test is not to find cancer, it's looking for blood. And the reason that is, these polyps and these adenomas, they bleed intermittently. And that's the blood we're looking for. So, we have, it can happen that actually maybe your polyp or your adenoma is not bleeding when you do the test. But it can actually detect minute amount of blood that we can't even see with our eye. So, I think people need to be really, really assured. It is very accurate. But that is also why we ask people to do it every 2 years. So things can change in that period. So it's really important to do the test every 2 years. Sometimes people do the test, they get a negative result, and they think, oh, that's it. Don't have to worry anymore. I was negative. But no, you need to do it every 2 years to make sure nothing's missed.
Okay. So at what age should somebody start using the fit kit? And
so
how often should it be done?
Right. So we've now lowered the screening age. It used to be 60 to 74, but over the last few years, we've now reduced that down to 50. So everybody from 50 to 74 should do the test every 2 years.
Okay.
And as Nazia mentioned, once you come over the screening age, you can still take part if you want to. I mean, I think the idea is that if somebody starts when they're 50 and completes it every 2 years, right through till they're 74, it's very unlikely that you're going to develop cancer if you've taken part in screening regularly every 2 years. So maybe if you haven't done it that regularly, or you haven't done it at all and you're 74 and above and you want to take part, you certainly can. But I think the important thing to remember, and there's a risk, it's a risk and benefits. You need to think about it like that, because as the older we become, we tend to get other illnesses, other comorbidities, and because if you do have a positive test result, one, you'll have a health assessment, obviously, but you have to go on a restricted diet the week before, but then also you have to take what we call bowel prep to clear the system through. So you need to have be at home and near to the toilet. And it's then about how, if somebody is older in years, sort of 80 plus, they may have other conditions that actually are they suitable, for the procedure. And also, we have had occasion where actually people, again in their 80s, early 90s, that develop bowel cancer, but then the decision needs to be made about would they survive the treatment. So there's all those sorts of things to weigh up. So that's why it's so important to start in your 50 when you get to your 50th birthday and do it every 2 years.
Okay, so what should someone do if the if the fit result comes back positive? I know one shouldn't be panicking, but it is
Sure.
quite worrying for elderly people.
Obviously, absolutely. Now, as Nazia mentioned, it's, and I've said that it's a test for blood, not for cancer.
Yeah.
And if you have a positive result, it doesn't necessarily mean you've got bowel cancer. So that's the first thing. So if you have a positive result, you are then invited to the hospital, and you'll see one of our specialist screening practitioners, one of the nurses, and they'll do a health assessment. And then also they'll reassure you, about your worries and about your concerns and really take you through exactly what's going to happen, for your procedure. The procedure is what we call a colonoscopy, where they look inside the bowel. And it can be a little bit uncomfortable for some people, but a lot of people they don't, it's fine. You can have sedation if you wish, both gas and air, Entonox, but also, intravenous sedation as well. You have to, it doesn't knock you out completely, because you have to you have to turn when the consultant asks you to turn and that sort of thing. So you're not completely unconscious, but it will really, really relax you. And I can speak from experience. I've had a few now, and it's absolutely fine. And I'm somebody who has sedation just to go to the dentist. So,
I'm sure you're not telling us how old you are.
you can just look at the white hair. Yeah, so really, it really is, it's, I think that some people, they can get a little bit bloated because sometimes they use carbon dioxide, because the bowel is very wrinkly. And so to smooth, to open it up and smooth it out, they can sometimes use gas, and that can make people feel a little bit, bloated. But that passes quite quickly.
There
But
is a
also,
question.
just
Sorry.
the most important thing to remember is you are in control. And if it's getting uncomfortable, you can just speak to the consultant and the nurse, and they'll do everything they can to make you more comfortable. So you are in control.
Okay, so there's a question in the chat. Why is bowel cancer common in younger populations?
I think there's two reasons. We know now that actually, if somebody's got what we call Lynch syndrome, it's a genetic malfunction. And that runs in, it's hereditary. And so people were getting bowel cancer very young through this, malfunctioning gene. But I think that's one, and anybody with Lynch syndrome is now automatically under surveillance and will have a colonoscopy every 2 years. Well, it's every 2 or 3 years, depending on the type of the mutation. But the other thing, it is undoubtedly the Western diet. The Western diet, and so much of our food now, is ultra processed. So even when it says it's healthy, you buy it at the supermarket. So it's things like ready meals, Pearson, stuff that you put in the microwave, lack of fiber in the diet, but also fast food, which young people love. And actually I was at a conference where somebody was speaking, and as the sort of Eastern Bloc countries opened up and these fast food chains went in, as they've spread across the Eastern countries, they've seen bowel cancer rising. So it's our diet. It's so, it's about getting back to basics, and cooking from scratch is what we need to be teaching our younger people.
So can diet, exercise really reduce bowel cancer
Absolutely.
risk? And if so,
Yeah.
how? And
Yeah,
if so, how?
it's all those usual suspects that Nazia spoke about that affect, our health so much. And so it is just taking a few simple steps to reduce your risks. And most importantly, is a healthy diet. Get the fiber in your diet.
Okay. So, are there any cultural or language barriers that make it harder for some communities to access screening?
Absolutely, definitely. We found that in some cultures, sort of translating written information into another language isn't enough because quite often the older generation from certain groups, they don't necessarily read or write their own language,
Mm,
let alone English as a second language. So
yes,
this is where that word of mouth becomes really, really important.
And
sure.
also, I just would like to add, Panna, while I was delivering session with some groups where English is not their first, language. So one of the thing which surprised me was like, of course, before you receive this kit, you receive a letter. Yeah, that you will be receiving the kit. Yeah, but it so happens, of course, they can't read the letter, and there is some, they don't understand that letter. And so many people who have received the kit, they mistook it to be as a COVID testing kit,
Yeah,
and they just threw it
that's
away.
true.
Throw it away.
Yeah,
Yeah,
so I mean that's when we are going to some other little deprived areas in Brent, and we're delivering these sessions. We of course we take people from their community or interpreters, so that even if we speak in English, or even we try, we want them to be comfortable talking about this topic also.
yeah,
Because it's a taboo, in a culturally, nobody talks about stool and all this openly, even with your family members. So it's sometimes culture, it's sometimes language, so it's just how you make that group comfortable through their own community members, faith groups, that's where we are trying hard to, best to reach.
I know
I
because
mean,
sometime back, we used to get letters. I think I'm talking about 20 years ago. If we received a letter for something, then we would get in two, three different languages because we are how many communities around here, different communities who
Mhm.
don't speak English, as you say. So people can pick it up. Just like our prescriptions, when we get something, there are different languages on the box itself.
Mm.
So it's
on the
advisable,
letter that
even the
you get
letters.
on the letter you get from the hub, there's a whole range of different languages saying, and then you can access the letter and information in your own language.
In our own language. Okay,
Yeah,
Yeah,
that's very
sometimes,
handy.
if you see here, I think
there we go.
there
Yeah,
are some instructions, but not all languages, of course. But then,
yeah,
there are certain languages, Arabic, Bengali, Gujarati, Polish. Yeah, some, but still we
yeah,
need to work because Brent has so many different communities, still.
exactly.
Uh,
And this is why word of mouth is so important.
mm, mm,
So for you all to speak to your family, speak to your friends, break down that taboo about talking about going to the toilet. We all, and it's interesting because I think it's Somali. Actually, the word for bowel is offensive. So
Yeah,
how can you talk about,
I know.
bowel cancer and,
Yeah,
when actually the word for bowel is very, very offensive? So it's these things that create barriers that we have to break down. And we find word of mouth is the best way to break those
absolutely.
barriers.
Absolutely.
Can I ask a question?
yes,
Yes.
Of
Nana.
course.
Is the occurrence of bowel cancer more prevalent in the South Asian community or the host community?
Overall, we're seeing, I mean, yes, bowel cancer is more prevalent in white British and white Irish. Um, but we're seeing as people, that have come to the UK and start adopting the Western diet and the Western lifestyle, that it is now increasing in some of those other communities. And I think the other important thing to remember is that actually, okay, you think, okay, well, it's more prevalent in the white population. I don't need to worry. That's not true, because what we found through our research at St. Mark's is that, okay, for instance, it's much less prevalent in the Black African and the Black Caribbean community than it is in the white British, the white Irish, or even Asian population, but their outcomes are worse. So although there may be lower cases, they're having much poorer outcomes. And that's generally because they haven't taken part in screening, or they're leaving it very late, not even seeing their GP, and then going to their to A&E when generally, if it's detected through A&E, it's generally palliative care is the only option. And also another interesting thing that we found is, yes, there's more positivity for bowel cancer in men than there is women, but we're seeing, again, poorer outcomes in women in all ethnic groups. So it's really, we must be really careful that we don't get complacent and think, oh well, it's more in men, don't have to worry then, but actually, and we're trying to do a bit more research into this. We're thinking, and what we're picking up anecdotally is that actually women are, they tend to put the health and care of their families above their own health, and so they're ignoring their symptoms. And that's why we're getting those poorer outcomes in females. So it is really important for both men and women to take part, and not, one, to take part in screening, and two, don't ignore any symptoms.
Thank you.
You're welcome.
Is there anyone else who wants to question them? This is your time. Speak up.
Yeah, come on. Get us while you've got us.
Exactly.
There was some questions, I think maybe as sharing their experience or something.
Hello, I have an experience.
Yeah.
I had a big swatsoma on my large bowel. I went for a colonoscopy and they saw that. I went to see him privately in Clementine. He couldn't do it there. He took me to Northwick Park, and when he did it, it was stuck so much into my large bowel that the bowel ruptured. We waited one day to see if it would heal, because you can't leave an open bowel. And it didn't heal. So I had a large bowel removed and my appendix removed. Luckily, I did not need a bag. And I survived, and I'm still here as a living proof. I was a high risk because my dad died of bowel cancer and my sister died of bowel cancer. So he was very discreet, the consultant. He said, oh, you wouldn't go to work if you had flu or you were not feeling well. And he coaxed me to go there because it was Christmas and we were having a Christmas party. But thank God, the whole family thought that was it.
Yeah,
but
that's good.
I have survived more than 18 years now.
Wow.
And it's all clear. But
terrific.
And before that, I was having regular checkups, and I've always been doing my toolkit, the stool test, every time they send it to me, even till now. And it's not very difficult. And it is in a lot of languages. You can't have it in every language, the borough has, people in the borough has, but the majority of the languages are there, Once you do it, then understand it is very easy. And you've always got people who are learned in your home who can teach you or guide you how to do it. So do not ignore. Thank you.
Thank you. Thank you for sharing that. Thank you very much.
Anyone else before I go back to the chat, because there's 2 questions in the chat group.
Well, I just want to say that tomorrow I'm going to a funeral of a friend who has just died of bowel cancer. And the question is, in my mind, is what a waiting list like for consultation if you want to see a specialist?
So, I mean, if somebody
stage 4 when she was stage 4 when
right, yes, that's the late stages. Through the screening program, if somebody has a positive test, where they found blood, we have to see them. We have to give them an appointment and see them within 28 days.
Oh, that's good.
And so that's through the screening program, but they may come through their GP. And if they're sent, it's what we call a 2-week wait referral. So if they see their GP and they do a test, it's what they call the symptomatic pathway, and it's a slightly different, it's the same test, but it's got a different strength. And again, they have to be, seen and referred within 2 weeks. And there's what they call the 28-day faster diagnosis service. So they have to be told whether they have or have not got bowel cancer within 28 days of being seen at the hospital. So we have very strict guidelines that we have to follow. And I've heard some people say, oh, well, it's very difficult to see my doctor, or he keeps dismissing me. If you've got concerns and you have symptoms, do not be put off by your doctor. You know, you say to your doctor, I am worried that this might be bowel cancer or symptoms for bowel cancer, and I want a symptomatic referral. And they have to do it. They have to do it. So it's about, you know, because we know doctors are busy and sometimes just getting an appointment, you know, but if you stress that you have got symptoms and you are worried about bowel cancer, they have to refer you.
Okay, that's
So it's really important to take part in the screening, but it's really important to speak to your GP if you feel you've got symptoms and you're worried, you know, because they have to refer you through to the hospital.
Okay, thank you.
Can I share something?
Yes.
My name is Preeti, and thank you, firstly, all of you, for putting this program on to, awareness to everyone. And thank you, Saraj, for sharing your story. Um, I'm currently going through the process. So I had bleeding. It started with spotting. So I thought, oh, must be piles, and I sort of left it because I had my mom wasn't well and I was looking after her, and it was quite a stressful time. So I left doing anything about it. However, what happened was I received a fit test through the post, and I, did the stool sample, sent it off, and I knew things were not right because my bleeding had increased, and I knew that I would probably be called, but what I didn't know was why I would be called. All I knew was I was bleeding. So about 3 weeks ago, I got called in for a colonoscopy, which was like 3 days after my mom's funeral. So it was really, really stressful time for me. But I went, and at the colonoscopy, they informed me that I've got bowel cancer, which was, well, the most unwelcome news. However, like Andrew, you said, I'm in St. Mark's, being treated by them, and I have to say I'm so impressed with how efficient, how caring, and the process that you have in place for fast tracking people like myself who have been diagnosed. So I went through at the colonoscopy itself because they already knew. Um, I actually received a phone call from the hospital asking me to book myself in for a CT scan and MRI scan, and this was before I'd even spoken to the doctor about my diagnosis. But anyway, they're very efficient. And then I had I had blood tests done. I had an ECG done as well at the time of the colonoscopy because obviously they're getting me ready for surgery. And yesterday I spent the a day in hospital getting further blood tests done. I had uh, I had to have an iron infusion because I must have become anemic and also in preparation for surgery. And I also had to go through the stoma consultation in case I need to have a stoma bag. So I'm awaiting a date for my surgery, which should be the next 2 to 3 weeks. Um, and I know I'm in good hands. Yes, it's worrying.
Of course,
Um,
of course.
but at least it's going to be better out than in. And hopefully I can then start my recovery. I don't know at this stage. I mean, I've been told that it's early, which is good. However, until they actually operate and, take out some samples and things and test them, they probably won't know exactly what my future treatment will entail. I'm hoping that it will be quite a simple operation without too much invasive or, treatments. And by that I mean chemo and radio and stoma bag, because I've been through cancer before 11 years ago for a different type of cancer, and my mom had bowel cancer 11 years ago. So they're also testing me for the Lynch syndrome. So I've had to do blood tests for that and fill out a questionnaire of family history. Um, so yeah, there's a lot to deal with, and
Absolutely.
it is a bit of a roller coaster because I'm trying to process the information as well as trying to come to terms with it and emotionally what it might mean for me and how it's going to impact my life and everything else. And plus, I'm still grieving, so it's hard. That's why I wanted to share this.
Yeah,
Please
no, thank you.
do the test. Please send it off because you just don't know. And it's better to find out than bury your head in the sand and pretend that it's nothing's there. At least if it's diagnosed early, there's a chance that they can do something about it.
Pretty
Thank you.
stay brave.
Yeah.
Listen, they did mine as a telescopic. There was no invasion, only when they had to cut the bowel and remove it. That is where I had a little scar on the side of a navel. It didn't show anything. So don't worry. Okay?
Yeah.
Life is more important than,
Thank you.
But thank you, because I
little
think,
scars.
it's stories like yours that can be so powerful, when you're talking to other people. And so thank you very much for sharing that.
Can I ask you a quick question? I'm sorry I joined halfway because I didn't have the link soon enough. But I know it's blood in the stool is one of the signs of blood cancer. Are there any other symptoms of bowel cancer besides the blood?
So, shall I take this, Nazia?
I mean, yeah, you can take it out. I can
Okay.
take it.
Yeah, I mean, the blood when you go to the toilet, blood in your stools is one of the most common symptoms. But some people don't get that,
Okay.
so it can be sort of discomfort after eating.
Right.
Change in your, again, one of the most common ones is a change in your bowel habits.
Right.
And if that, we all get an upset tummy from, time to time. So it's if it persists for 2 or 3 weeks,
Yeah.
that's really then, that's a bit of a red flag. So, changing the bowel habits, discomfort when you eat, bloating, going to the toilet more often. But another one is actually feeling like you still need to go to the toilet, even though you've been.
Right.
So
Right.
that feeling that you still need to go
Yeah.
is another one. So any of those sorts of things,
Right.
they're a bit of a red flag, and that's when you need to speak to your GP.
Okay.
I had IBS for quite a while
Right.
before all this happened.
Yeah.
So that was the trigger, and then bloating. So
Yeah.
there are
Yeah.
a few signs, different signs.
And I think we're,
Constipation doesn't help either.
no, we're terrible. We sort of, it'll be all right,
Yes,
it'll be
yes.
tomorrow. My mum's a classic. She'd never done the screening test, and she's always, no, she's Scottish, my mum, and she's like, no, what's for me is not going to go by me. Meaning God willing, it's what's for me is for me. And I said, Mum, all right then. But if by doing the test and they found something early, and that was to give you another 15 years with the grandchildren, would you do it? Oh yeah, of course I would. When you make it that win-win, my children, my grandchildren, then should do it. So it's about trying to make it a win-win for everybody. But yeah, anything that you're concerned about, speak to your GP.
Thank you so much. Thank you.
Yes.
You're welcome.
Andrew, there is another question on the chat saying, can
Sure.
dark hair dyes cause bowel cancer, as I
I
heard a while ago?
No, I'm pretty sure the answer to that is no. I think I would be, I think with some of the hair dyes, you probably want to be, a bit more concerned about skin cancer. Because there's some of the, particularly if you've got white hair and you're dyeing it darker, some of, depending on but some of those chemicals are pretty strong, so, but I've never heard of a case where hair dye has caused bowel cancer.
Okay. There's another question. I have piles, and when I go for stools, I think she means to say, I used to get blood and used to get constipated. My doctor has given me Comocol, and I now get soft stools, and sometimes it is runny. the blood is reduced.
Right. I mean, again, if piles is very common with constipation because you're straining, to go to the toilet, and it can be very painful, really, really painful. So piles and constipation go together, but I think, if the medication softening the stools, that tends to help an awful lot. And if you're getting diarrhea a lot, again, I would speak to the GP. You may need to adjust the medication, or it may be something else is going on, and you want to check that out.
Yeah. Anyone else with the questions? No?
A
Then
very nice session, Panna. Very nice, very informative session.
Thank you.
Thank
Yes,
you.
what I wanted to say something, that what's one message you want everyone here today to take away and share with their family or community. But I think this has been shared by Priti. Priti, I am very sorry to hear this, and I wish you all the very best. What you're going through, our prayers are there for you all. And you know what? Everybody must go for this test. When you receive a little box in your doorbell, in your door, just go for it and do it. It's not hard. The new kits are very good and quick, like Nazia and Andrew said, that there is no harm, no smell, no nothing. It's just like a teeny weeny spoon with a tube, and you just put it in, and that's it. You're not even touching it, you're not even going to smell it, no nothing. And it's only small thing you need to put in, like a dot, and that's all they need. And from that, you'll get tested and everything, and it is very good. So here's my summary now. Thank you so much to everyone who joined us today for this important session on bowel cancer awareness. A huge thank you to our brilliant presenters, Nazia Ali from Brent Health Matters and Andrew Prentons from St. Mark's Hospital, for sharing such valuable insight. So we've covered a lot today. The importance of the new Fit Kit and how to access it, understanding what bowel cancer is and why early detection saves lives. So recognizing the symptoms and the risk, breaking down the barriers that stop people from getting screened. It's not hard. And most importantly, how to take steps towards prevention through awareness, lifestyle, that's the main thing, and regular checks, and not eating rubbish. Eating rubbish causes more pain,
Yeah,
I think. Yes. So that's
definitely.
not healthy eating. And if there is one key message to live with today, it's this: don't wait. Take the test. Talk to your family, help others take actions. Actions is the most thing. So please feel free to reach out with any follow-up questions, and don't forget to share this knowledge in your community.
Yeah.
So our next session is going to be on finance, well health. So that is going to be next week. And if anybody else wants another subject to discuss, please contact me, myself, or Kamlesh, who are dealing with this well-being, so we can pile up everything as we go along. Thank you once again, Andrew and Nazia, for a lovely,
You're welcome.
informative
Lovely to meet
session.
everybody.
Lovely to meet
Lovely to meet
everybody.
everybody. Thank you.
Thank you so much. Take care of your health
Bye-bye,
and
everybody.
take care. Bye-bye.
Thank you all. Pretty, all the very best, and take care.
Yes, Preeti, all the best. Yeah. Thank you. Take care.
Take care. Thank you very much. And we shall catch up next week with our finance well-being.
Yeah.
Doris, this will be very good for you.
Okay.
And be ready with the questions as well. Thank you again, all,
Okay.
everybody. Good
Thanks,
night.
everybody.
Good
Bye.
night. Good night, all.
Good
Take
night.
care,
Bye.
Nazia.
Thank you.